Good morning, guys. Welcome back to NCLEX session. We are on part 9, and I am Professor Diane Anderson. I've been a nurse for over 20 years. Area of expertise is mostly critical care, including IMC, PCU, ER, and so on and so forth. I talk more about myself in sessions part 2, 3, and 4. So to find out more about my background, definitely tune in and listen to those sessions. Today I have a complex group of questions, but I kept it like a medium to hard level, or I should say more critical thinking skills when I say medium to hard. In part 7, that was extremely easy. In part 8, it was a mixture of easy to medium, but this one is definitely medium to hard. So let's just jump right in there and see how you do. Question 1. Which cells produce glucagon in the pancreas? Is it A, alpha cells, B, beta cells, C, delta cells, or D, kappa cells? If you chose A, alpha cells, you are correct. Now remember, beta cells produce insulin. Your delta cells produce somatostatin. Your kappa cells are not part of the anatomy of the pancreas. Question number 2. A patient is admitted to the ICU after being found down with an altered level of consciousness. Which of the following symptoms would indicate the patient may be experiencing alcohol withdrawal? Is it A, hypothermia, B, hypermagnesemia, C, bradycardia, or D, tremors? If you chose D, tremors, you are correct. Signs of alcohol withdrawal can begin within 24 hours after the last drink and may continue for 1 to 2 weeks. Alcohol withdrawal may produce insomnia, delirium, visual and or auditory hallucinations, and also seizures. Let's go over the reasons why the other answers are incorrect. Okay, so guys, hypothermia may be expected for a patient that is found down for an unknown amount of time, but is not expected with alcohol withdrawal. And then we have hypomagnesemia, which would be expected secondary to long-term alcohol use and its associated malnutrition. An elevated temperature, heart rate, and blood pressure is expected in alcohol withdrawal, along with diaphoresis, anorexia, nausea, or vomiting. Question number 3. A patient with bacterial endocarditis should be closely observed for which of the following clinical changes? Is it A, pulmonary edema, B, neurologic impairment, C, olguria, or D, rising liver enzymes? If you chose B, neurologic impairment, you are correct. Now remember, guys, one of the risks of an infective endocarditis is the bacterial strand breaking in the heart and throwing bacterial emboli forward into the lung from the right side of the heart, or to the brain and body from the left side of the heart. Neurologic impairment could be a sign of an ischemic stroke from that emboli being thrown to the brain from the left side of the heart. Okay, guys, question 4. This should be a little easier for you. A patient and family are struggling with a terminal diagnosis and having trouble making plans for end-of-life care. The patient will be discharged home in 2 days. Consultation to which of the following services is a top priority? Is it A, chaplain service, B, physical therapy, C, nutrition services, or D, palliative care specialist? If you chose D, palliative care specialist, you are correct. Palliative care practitioners excel in assisting patients and families with establishing an end-of-life plan that reflects the patient's wishes and desires. Okay? So they can be key partners with social work and nursing and hospice to ensure a smooth discharge process and integration of services both in the hospital and in the home. Okay, guys, this is a little bit more difficult question, especially for you nurses that are either in the critical care arena or are looking to go into the ICU. Okay, so question 5. The purpose of utilizing PEEP in adult respiratory distress syndrome is to do which of the following? A, prevent collapse of distal airways. B, promote secretion mobilization. C, decrease interstitial edema. Or D, to improve the pH. If you chose A, prevent collapse of distal airways, you are correct. Now remember, in ARDS, also called ARDS, also called adult respiratory distress syndrome, distal airways are surrounded by swollen tissue and edema. If they close at the end of expiration, they're going to require a great deal of pressure to reopen it. Okay, guys? So providing higher levels of PEEP, PEEP, allows airways to stay open, and it maximizes ventilation, leading to improved oxygenation. And I bring this up because, in the ICU, you're going to be dealing with a lot of ventilators. And yes, you have your respiratory therapist there, and they're the ones that's actually programming the PEEP. The nurses are not. But you still need to know why your patient's on it. Understanding the whole pathophysiology behind it will help you to remember and understand the questioning and the reason why the answer is what it is. Okay? Okay, guys, and our last question, number 6. A patient presents with chest pain for 6 hours. Her 12-lead ECG is unchanged from 4 months ago. Which of the following would be the most appropriate for ruling out a myocardial infarction, or MI? Is it A, cardiac catheterization, B, stress test, C, troponin 1, D, transthoracic echocardiogram? If you chose C, troponin 1, you are correct. Now remember, troponin is a cardiac biomarker. And when you have even the absence of ECG changes, cardiac biomarkers are the most sensitive indicator for myocardial ischemia and a myocardial infarction. And it will help differentiate if it's a non-ST elevation MI from an unstable angina, which is just having chest pain, or other coronary syndromes. So other diagnostic tests may be needed to help determine location or effect of the infarction, or to intervene where vessels are occluded. But we need to find out if there is an actual MI or myocardial infarction or heart attack, whatever term you're used of, that cardiac biomarker is the most sensitive indicator. Again, the troponin. Okay, good job. So I know those questions were a little bit more difficult, but, in school we have students that some are really good with the easy questions, some are good with the easy to medium, and some are good with the more complex. So I want to make sure when I do these videos that I'm covering every type of student. If you did not get these questions right, it's okay. Go back, review, listen to the rationale that I'm explaining. That'll help you to better understand why the answers are what they are. If you need to go back into your textbooks and look into your pathophysiology to break it down even further, do so. But my rationale should be enough for you to understand. Okay, guys? And again, this leans more to nurses that are either in the critical care arena or would love to go into that area. So I'm trying to get you used to thinking the way you should be thinking in terms of critical thinking for the ICU, CVICU, the MICU, the SICU, those type of areas of nursing trauma, those kinds of area. Okay? So if you have any questions or if you need any tutoring, please feel free to contact me on my email, which is admin@skillsnacks.org. We do offer tutoring services, and I can give you more information via email about the times that we have available and the prices, etc. It's cheaper if you do a group because we have group discounts. But either way, we do one-on-one or group sessions, all online, and it's very easy and simplistic. And it doesn't matter if you're a day shift person or a night shift person, we work with you. Okay? So thanks again, guys, and stay tuned again for our next NCLEX session, which is part 10, coming soon. Have a great day, and please don't forget to like and subscribe and show support for our channel so we can continue educating you and get you further where you need to be in your nursing career.